It's that time of year when we're all indulging in the holiday season, and maybe some of us are indulging a little too much. That's why it's time to start thinking about getting rid of some of those extra bulges that we put on through the holiday seasons. I'm here at the Bengtson Center for Aesthetic and Plastic Surgery, and I'm here with Amanda Veldman. Amanda, what is CoolSculpting all about?
Yeah, CoolSculpting is an FDA-approved system that helps. It's non-invasive and it helps to permanently reduce the number of fat cells in the area that is treated. And it's non-invasive. There's absolutely no recovery time. You can go work out right afterwards or go to work, and that's completely fine.
So there's no downtime at all. But tell me how the procedure actually works, because you're freezing these fat cells.
Yes, it works by actually freezing the fat cells, and the fat cells kind of self-destruct, and your body basically metabolizes and clears them away for you over a process of about 60 to 90 days.
Wow, and so those of us that might have the extra love handles, you can target specific zones to meet your needs.
Exactly, yep. There are a lot of people who will do their love handles or their lower abdomen. Those are the two most common areas. There's just that small bulge of fat that they just can't get rid of, and it's perfect for that.
Okay, I love that there's no downtime, but how long does the procedure actually take?
The procedure takes an hour per area. So if you're doing like your love handles, it will be an hour on one side and an hour on the other, but your abdomen is usually an hour, so it's an hour per area.
Amanda, you have actually been a patient of the CoolSculpting.
Yes, I actually did this almost 3 months ago, and I did my love handles because there were just a couple pair of pants that I would wear, and I would have the so-called muffin top so many people talk about. So now 3 months later, all my pants fit perfectly fine, and it really truly does work.
It does work. Okay, this is really exciting new technology. I'm ready to talk to the patient. Okay, right beside me is Kelly Stecco, who has agreed to talk to us during the CoolSculpting procedure. You look pretty good. How do you feel?
It's so easy. It's great.
So tell us exactly how this feels right now.
You know, if I could compare it to something, and it's for the gals that have had a mammogram, it almost feels a little bit, you know, it takes the area that you want to work on and kind of smushes it, smashes it like a mammogram. It's not uncomfortable.
So no pain, and it's targeting one area, which is so nice, especially getting ready for the bikini season.
Yeah, yeah. You know, I always have had that one area. I've, you know, been lean through here, and just the lower abdominals has always been just that target area, if you will, for me. And I think a lot of gals have a hard time with that area. So, you know, when I found out it's, you know, you can target, and it's for the gal between 5 and 30 pounds, I thought this is a great fit.
Perfect. Already ready to say bye-bye bulges?
I'm ready to say bye-bye bulge.
Bye-bye bulges.
Bring on the swimsuit, right?
Dr. Bengtson is here with us today to tell us all about it. You know, Kelly and Amanda are just great examples of the types of people who really can benefit from this kind of a procedure.
Yeah, absolutely. First of all, Amanda's our kind of Bengtson Center Vanna White, you know, with exceptional nursing, you know, capabilities and stuff. So
yeah, she's brilliant and beautiful.
Yeah, exactly. Yeah. So my wife says it's good that she's you know, very comfortable with our relationship with all the beautiful women I work with. So.
Yeah, exactly. Well, you know, tell us about how CoolSculpting works, because it really is quite remarkable, the technology.
It is. It's very, very interesting, and you're right. Kelly and Amanda are really ideal candidates. So the ideal candidate is really someone who is at their ideal body weight and just has these little genetic pockets of fat they can't really get rid of, or up to about 30 pounds or less above their ideal body weight. And it's very intriguing technology. Investigated a lot before we actually pulled the trigger and purchased it. But it's a real phenomenon, non-surgical, very, very, you know, not painful. Essentially, 1 or 2, you know, out of 10 most patients talk about, and it essentially suctions up the fat between 2 cooling plates that decreases the temperature down to about 4 degrees, and then just selectively destroys the fat cells in the area. And so over about, you know, 2 to 3 month period, you just start to notice a weight reduction or fat reduction in the area. And typically we're seeing areas of about 30% to 40% of the thickness or tissue thickness that it's actually reducing. And it's looking like it's going to be about 50 to 60% as effective as liposuction.
And we're looking at some of these before and after pictures. Tell us some of the difference here. What are we seeing?
Yeah, so the back fat and bra fat women hate. I guess guys do too, but
They don't wear bras
it's
as
a
often.
really, yeah, well, some women pay so it's a very difficult area to treat, even with liposuction. So this is a great advent to the treatment of these areas for sure.
Now, are some people predisposed to get fat deposits in certain areas? Because everyone seems to have that problem spot that they complain about. It has to be different for everybody. And then what happens if you have this done, or if you lose some weight and then maybe gain 5 pounds? Does it go right back to the same spot?
Yeah, it's a really good question. So our fat is really genetic, and it collects in different areas. In men, it typically is around the love handle, trunk area. So there is a genetic component. There's also a patient component that once an area is treated, we're born with a certain number of fat cells, and they just increase in size and decrease in size. So areas that are treated either surgically or non-surgically, the fat cells are reduced dramatically in number. And so if you do gain weight, they tend not to go back to the areas that you've been treated but definitely there's a patient aspect too. I mean, you have to continue. It's not a substitute for weight loss,
Sure.
right? So,
Right. And you were saying, just based on the way many men would carry their weight, this is a procedure you're seeing a lot of men coming in.
It's great for men. About 30% of our patients so far we've treated have been men. And I think, genetically we're kind of predisposed to have a little bit more fat in the areas that this is most effective for. And also, I think as men, we can really tolerate less downtime, and patients can go right back to full activity, whatever they're doing. You can actually work during the treatment and be on the cell phone, computer, whatever you like.
Right, even a physically demanding job.
Exactly, right back at it.
Yeah, and this sounds like something a lot of people are probably going to want more information on, and you actually have a seminar coming up this week for it.
We do, a couple days. I think it's the 30th, right?
Right, Wednesday?
Wednesday night. We're going to give a seminar, and really it's just an opportunity to come in. Not everybody's a candidate, so to kind of find out if you're a candidate or not. If you have Dunlap's disease, you know what Dunlap's disease is? It's when your belly's Dunlapped over your belt.
Okay.
So you have that. Sometimes you need a surgical procedure in addition to a fat reduction procedure, but yeah, so find out more about it.
And it's at the Bengtson Center, which is just a beautiful facility, great place to have that opportunity to engage with the technology as well. You also have some great specials that you're offering for 8 West viewers.
Yeah, we do. We are operating complimentary value-added sort of things, so like Botox, Latisse, and/or we have a really cool new Vizia scanner for skincare analysis and that. So we're offering that in conjunction with some discounts for 2 or more areas treated.
Fantastic. Well, we know that you're easy to find, and we'll get all your information on our website. And by the way, to take advantage of those procedures, the specials, you have to call today and say you saw it on 8 West.
Yeah.
Thank you so much for joining us.
Yeah, thanks a lot. Do you think Terry's, or do you think Rachel's watching?
Yeah, I was going to say, would she be a perfect candidate after just having that baby?
It's good for post-baby
Okay.
fat reduction. So if Terry, or Rachel, if you're watching out there, it'd be great.
Yes, exactly. Dr. B has an appointment just for you. We'll be right back.